The scope of the addiction problem is epidemic. The Center for Disease Control has called prescription drug abuse an epidemic, and they don't use that term lightly. More Americans die from unintentional overdose than die from motor vehicle accidents. We found now that the abuse of opioids, unintentional overdose deaths, have actually decreased the anticipated lifespan of a segment of Americans, particularly middle-aged white women. The scope of this problem is enormous. We have about 2 people in this country die every hour from opioid overdose. You know, addiction was treated the way many central nervous system diseases have been treated in the past, which is as a moral failing or even a curse. Something is wrong with the person culturally from our background who's got an addictive disease. We used to stigmatize people who had Parkinson's disease, tremors, who had other CNS illnesses like dementia, and we don't really do that anymore with diseases other than the disease of addiction. We've also had this construct of addiction as being a moral failing that people can just get over or pull themselves up by their bootstraps. And we really have a construct now as doctors, as medical professionals, that addiction is a chronic brain disease. It's very hard, though, to get people throughout the entire population to understand that, particularly people who are well aware of our traditional 12-step modalities, which is a spiritual approach, and has worked for millions of people in treating their alcoholism. We found that the approach that worked for treating alcoholism has not worked as well for treating opioid addiction. And we've, as a society now, been hesitant to follow what evidence-based medicine shows us about treating opioid addiction, which is particularly the use of medications, in an ongoing way, the way you would any other chronic disease state.